guys, it's Khaki. Today I want to talk about fear. Fear that we have before we have bariatric surgery. This is a topic that was recommended or requested by one of the channel viewers. If there's something you would like to hear me talk about, please put it in the comments below and I'll add it to my list. One of my biggest fears, and I think is pretty common among those in the bariatric population, was of the surgery itself. I had had one prior surgery, but it was a foot surgery and it was an outpatient surgery. I was from the operating room to discharge 3 hours, so this was a bigger surgery. I was worried about not waking up from the anesthesia, of dying during surgery. I was very worried about my pain level after surgery. I don't consider myself to have a really high pain tolerance. So I was, this is a surgery that involves a major part of your body. So I was really worried how the pain was going to be and was I going to be able to deal with it. The reality was when I woke up in recovery, I was in quite a bit of pain. I was given something in my IV immediately for pain when I requested it, and it got much better. I did get medication a couple more times during the night. I stayed overnight, but by that evening, I was up walking around in my hospital room. I actually was on my laptop doing a little bit of work that evening. I was worried about nausea after surgery. I had Zofran. I took that for a few days as needed, but overall, it wasn't it wasn't a bad thing. Honestly, I was really surprised by how minimal my pain was after surgery. I don't know that I would even after that initial day, I don't think that I would even call it pain. I had a little bit of discomfort, had a lot of pressure and gas pain, but I got up and I made myself walk around my house. And that helped more than anything. After that first day, I did not take any more pain medication when I came home. So, surgery is a real risk anytime that you go under anesthesia. But for me, I had a really good experience, and everything that I have read says that a laparoscopic gastric bypass, or RNY, carries the same potential mortality risk as a laparoscopic gallbladder removal. So remember that. Remember that. We all hear the horror stories, but try to coach yourself in reality and remember that the reality is the vast majority of people come through this surgery and wake up on the other side, and after a few days of being uncomfortable, do great. My other fear before surgery was of post surgical complications. I'm sure most of us read the support groups, the online forums, and let's face it, folks, the squeaky wheel gets the grease. People tend to go on and talk about the bad things that have happened. I think that very few people tend to go on and talk about the good things, or a lot less few. My personal fear, I was worried about having a stricture at the opening of my stomach. I was worried about having a leak. I was worried about longer term complications, not being able to eat real food, about having to live on a liquid diet for the rest of my life, or God forbid, get IV nutrition. I was very worried about not being able to do anything or go anywhere because, we don't. I had this vision of me going out to eat with friends and taking a few bites and running to the bathroom to throw up. That was my biggest fear, was undergoing this surgery to be in a position to do more and crippling myself because of it. The reality for me is that after that 2 week liquid diet that was recommended by my surgeon or ordered by my surgeon, as I slowly reintroduced foods according to how my team told me to, I've tolerated everything very well, with the exception the first few months I couldn't eat eggs, but I just avoided eggs. It wasn't anything that crippled me or took away from my quality of life. The other reality for me is that I can go and do things now that I wasn't able to do before. As most of you who follow my channel have probably seen, I go out to eat a lot. I travel a lot. I do those things confidently without worrying about being sick. Again, everybody is different. The other thing that I was really worried about was hair loss. You read here again those horror stories online about people who end up having to wear a wig because they have so much hair loss. Which I'm going to make a separate video about this at some point. This was requested. I did have significant hair loss. My hair loss started at about 4 to 5 months and continued to about the 8 or 9 month period. I found a lot of ways to kind of cover that up, including this powder from Amazon that is like a tinted hair thickener that kind of made my hair look thicker. But the reality was, it has grown back and it is even more full than it was before. The other reality for me was I felt so good that, yes, seeing those clumps of hair in the shower was scary, but I felt so good that it was very insignificant in the big picture of my overall health. I also had probably my biggest fear that this surgery wasn't going to work for me. I think that a lot of us view this as our last ditch effort to achieve a healthier life. And what if I was one of those 1 in a gazillion people? It just didn't work. I think that was probably my biggest fear. What if I put myself through a major surgery? What if I do everything right and it just doesn't work? I don't lose weight. Here again, the reality for me and for the vast majority of people is success. You will achieve weight loss. It may not be at the same speed as everybody else. It may not be as fast as you want it to. You know, the reality is weight loss, it's not straight down, it's woo, but it does continue down. At a year post-op, I had lost 127 pounds, which is just an unbelievable goal, unbelievable result to me. But it was a huge fear for me. I can tell you, as a primary care provider, I have had countless patients have weight loss surgery. And the patients, I'm going to say, I can think of one patient who did have serious complications in 20 years. That patient had some underlying blood clotting disorders that was undiagnosed, that they would have had a poor outcome. They didn't die. They're fine now. They're doing great. But would have had a poor outcome had they had to have an emergency appendectomy. So it wasn't the weight loss surgery itself. It was being inactive for a few days after surgery and that underlying health issue. But the vast, like I said, except with the exception of that one patient that I have done so well. And the more work that you put into it, or that they have put into it, the better they have done. So guys, I would love to hear, what are your, or were your, fears prior to surgery? What has sparked those fears? Are you seeing things online? Do you have a friend that went through something? You know, I think we've all heard about that. Well, my best friend's great aunt had gastric bypass and she died. So I'd like to hear where those fears come from and, talk about them below. If you have any questions, I would love for you to ask below. I will do my best to answer. I'm not a weight loss expert, but I am a weight loss patient. Guys, I hope you have a great week, and I will see you next Wednesday. Again, if you have any video suggestions or anything you would like to hear me cover, please put it in the comments below. Bye.